Chairman, conference. It is your aspirations, your drive, that delivers the benefits and quality of care in the NHS. Your drive, over and above the call of duty. As indicated once again by our survey published this week, showing 1 in 4 of you still working over 55 hours a week. Your enthusiasm has brought the NHS to its 60th anniversary, and your enthusiasm will take it forward. Reaching your 60th anniversary is meant to be especially fortunate, one of good omen, represented by the diamond, unconquerable, enduring. We should be hopeful for the future of the NHS, but can we really trust our political leaders to ensure that the NHS survives and thrives and remain unconquerable for the next 60 years? To move forward, the NHS needs 3 essential elements, essential to its success. It needs vision, it needs trust, it needs leadership. But do we have these in the NHS today? Whilst there's still much to learn, any analysis shows that our NHS, and it is our NHS, is a massive achievement. Perhaps the massive achievement of our modern political history. Our most precious piece of social capital. One envied by many across the globe. The NHS still gives best value for money, equitable and universal healthcare. It is precious. We must support it. It is my passion to protect it and promote it. Make it your passion too. Thanks to the NHS staff, it is transforming, despite the interference of government and the meddling of politicians. Patient satisfaction in the NHS is increasing. Productivity is improving. 1.5 million patients and carers use the NHS every day. 1 in 40 of the population work in the NHS. As was stated at the beginning of the NHS, everyone, rich or poor, man or woman or child, can use any part of it. No insurance qualifications, relieving your money worries at times of illness. A universal service of which we should be proud. We are proud. Waiting times are at record lows, delivered not by the private sector, but by the hard work and the dedication of NHS staff, led by consultants. It is your hard work, your leadership, your innovation that delivers for the NHS. We know it, our patients know it. It's just about time ministers acknowledged it too. So ministers, stop wasting time and money on poor procurement in the private sector and invest more intelligently in the NHS. Your history of contracts with the private sector is dire, so dire even the CBI has criticised your record. We have shown how well we can repay the investment. We will show you how much can be delivered. Let's look at their track record. Independent sector treatment centres, wasted millions. Money paid for contracts and work not done. Questionable outcomes. Multi-million-pound legacy payments still to pay. A multi-billion-pound price tag for the whim of a Prime Minister. How much can be done with clinicians who know how to do it better if we only put the money in the right direction? The Private Finance Initiative, the elephant in the Treasury. How haunting the Golden Rule, held off balance sheet this year, but £33 billion of debt will be added to the deficit next. This will do little to raise confidence in the fiscal abilities of this government, leaving the NHS saddled with long-term expensive debts with uncertain income flows. Their future mortgaged for a government whim. It is sanguine to note that the recent announcement from Scotland of a fully government-funded major hospital to be built in Glasgow. This will be built with the profession, with the public, and for the public, using public funds. Not against the profession, despite the needs. Not against the profession, despite the needs of the public, using public funds for future profits of the private sector. Really, who has the correct vision here? Let's look at commissioning. There's much talent across the NHS, a font of knowledge, needing to be nurtured and fostered. We don't need to run to the private sector, blinded by the lure of management consultants, the private organisation promising the moon, but only after a swift amount of money. For the real world-class commissioning, you need clinicians, the best across primary and secondary care. Patients want the best. We must promote the best for them and take up the challenge This is a better vision. The public's view of their local NHS is significantly better than the perception of the National Health Service. It is the government's handling of the NHS that is at fault. Give it back, take your hands off, stop meddling. Let the professions lead, hand in hand with the public, and you will see progress that our patients want. It is this combination that is delivering the best and the most successful hospitals, not central interference. A better vision built on trust. We have the vision, we have the trust of the people, and we have the skills to deliver. Our challenge as consultants is to bring the leadership required to our joint vision. The opportunity is there. It is ours to take. Now is the time for us to step up to the mark, take the positions of leadership, and deliver for our patients. I move.